Right. We're here. Okay. Technical difficulties resolved, but that's okay. Anyway, welcome. This is our fourth episode. Can you believe that, Gene? Our fourth one. And
Yeah, that's something.
That's something, man. We're already in May. We started in March. Anyway, we have a pretty cool show for you guys today. Um, our topic today is how to choose the right CDMO partner, right? So, Gene, I wore my science shirt today in honor of this because it says science like magic, but real. And, choosing a CDMO, well, may seem like magic, but it's real. And
Yeah,
there is a methodical process to go through. There's 8 steps. We're going to go through them today, and it'll feel like magic when you're done. Then you'll have the roadmap on how to do this. So, anyway, but first,
it'll save a lot of people a lot of hassle if they follow these steps, I'll tell you.
yeah, and we'll share some stories along the way for us in terms of what our experiences are. We're working with CDMOs. We've worked with dozens of them all in the industry. Uh, we won't use names, but we've worked with a lot of different people over all types of dosage formats, everything. So, but we'll go through all that. But before we get into that, let's do a little housekeeping. So yes, you can follow us. Don't forget to follow us on LinkedIn on the Bioactive Nexus page. Also our YouTube channel, and then Facebook as well. If you're on Facebook, you can follow there too. Eventually, we're going to stream there, but we don't have that many followers there at this stage. And we are after our live show here and post production, it's going to go up on Spotify and then distributed to Apple Podcasts, Amazon Music, iHeartRadio. You can go to the website and see all the updates and see all the different channels. Some of them I've actually never heard of, Jane, that are for podcasts.
That's because we're old.
Well, it's funny because just I may have mentioned this before in a previous episode, but the bottom line is that there's actually everybody's migrating to video podcasts. Audio podcasts have been around for a few years, so
Oh,
but
yeah.
YouTube a year and a half ago, actually, yeah, almost 2 years ago, migrated to that. In fact, Google Podcasts is going away in July, so they're totally migrating off of that platform and totally on YouTube. And same guys own them. And same with Spotify. It's now video because they bought Anchor, which was a video podcast platform. So they did that last year. Actually, I'm not sure when they did that. I think it was in 2019, to be honest with you. So so you can watch it, or you can on Spotify or the YouTube channel or our website. Either one. It's going to be in all places. Um, and that's it. So, and don't forget to send us your questions, ideas by email, things that you guys would like to hear about, comments. Gene, I've started to get some testimonials in. I'm going to add a testimonials page to the website. Uh,
Nice.
yeah, it's kind of cool. So keep sending those in, guys, and we'll build that out, and so we can build our
Very
footprint.
cool.
Very cool. So without further ado, let us go into the first step.
Mhm.
Boom, boom, and so first step: define your requirements. Okay.
Big step. Very important. And
Yes.
I think in the outline that we were putting together, I think it's important to understand the difference between a CDMO and a CMO.
Exactly.
And so I think that's because not everybody necessarily needs both. But I think a lot more people need a CDMO
Yeah.
than actually think that they do. So
So
you
what
wanna you
is
wanna
so
run
what
with that
is
little?
yeah, so what because you know what I really wanted to bring this up because people interchange these terms all the time, or they say co-man or whatever. So there's a lot of slang language or acronyms. Okay, so let's define what those are. So CMO stands for Contract Manufacturing Organization. Okay?
Right.
It could be just a packager that does that, right? But the difference with a CDMO, which is most of the ones we work with in the industry today, is a contract development and manufacturing organization. So this means they basically have the science team. They've got this, the scientific functions in house, and you can rely on them for help with and support for formulations, et cetera, et cetera. So really important to define the differences. People say use them interchangeably back and forth, but you need to be careful about that because they're not the same. So you need to kind of organize it that way. In fact, I don't work with any CMOs. Do you, Gene? I don't think so.
No, I don't. I don't.
No.
And I think another important distinction that even goes beyond that, whether you're talking about a CDMO or a CMO, is the fact that you may work with a very good CDMO, but that doesn't necessarily, it may mean, but it doesn't necessarily mean that they're going to be able to adequately help you develop your own formula and claims and everything from scratch. Some of them do have somebody on staff, but a lot of times they don't. And I want to differentiate here between a formulator who does conceptual formulation and one who does manufacturing formulation. So conceptual formulation is the kind of thing that, well, you and I have done a lot, Bill, where we come up with a formula. We say, let's just say it's going to be for prostate health. And we say, okay, we are aware of these different nutraceuticals that have these benefits for prostate health, and you need this milligram amount to achieve this specific effect, and so forth and so on. So we'll put together a formula based on the science, based on what's needed. Then we'll come up with claims. And we'll say, okay, here's the kind of claims that you can make that are both compelling and compliant. And even further, here are the studies that support those claims. And that's what a conceptual formulator can do. That requires somebody with a background, not only in science in general, but understanding the use of those nutraceuticals for the purpose intended and how to reasonably put them together in a way that gives you the right kind of claims. Now, a conceptual formulator can turn their formulation over to a CDMO, and the CDMO can then develop it in a manufacturing way where they'll say, oh, I'm going to put in these excipients, add to the recipe and make it in a final form and be able to manufacture it into a final product. But that just to know that that's not always something, that conceptual formulation isn't always something that a CDMO can do. And if you find one that can, dang, man, that's a good one to stick with.
That's true. And at least in my experience, because I am a product formulator, I don't really rely on the CDMOs for that. But there are some really good CDMOs in our industry that do have some really talented people on their science team and know how to formulate products very well. So, but there's not a lot of us like that. So, So the main thing is, first, let's get back to the basics here on defining requirements. So what are your products needs? Are you looking, what format are you looking for? Is this a vitamin mineral supplement? Is it a gummy, or is it, these sorts of things? You need to make those determinations at that time. And then, you want to look at the quality standards of the CDMO. Okay. So when you're starting that first initial screen, you might want to put together some format of a checklist of different requirements that meet your requirements. But first, you're going to need to define what you want, right? You need to know what you want. And time frame.
Time frame is very, very important. You mentioned previously, just like, are you doing capsules, tablets, powders, gummies? What are you doing? And obviously that's very important because especially in the case of something like gummies, look, not all contract manufacturers do gummies, where most may do vitamin, capsules or tablets. Not everyone will do this. So you really have to be clear. And then somebody might say they do powders, but do they have some flavor scientists on staff that can actually help with the flavoring of them? Because if they don't, all right, then they may not be the best one to go to for a powder, even though they say we can do powders. So so your point, Bill, of defining what you need is really important in the first instance.
Exactly. And that leads us into our next step, which is researching potential CDMOs. So let's transition to that.
And one more thing, before that, is that as you're determining what you need to think about volumes and scalability. And so this is important because let's say you have an initial order and everything goes fabulously well, and you're like, oh my God, my next PO, I gotta have to double or triple the order. All right, how well set up is your contract manufacturer for doing that? So you have to
Hmm.
determine, are they have scalability, but also sometimes, you're a new brand owner, you're just starting out, you really want a minimum order quantity, you want to start with a very low amount, and you go to a CM, and they may not always do a small amount. They may go, well, my minimum order quantity is 5,000 bottles.
Right.
And so you may go, oh, that's too much for me the first time. So you have to ask those questions up front to see who's
Yeah,
going to work with you. Now, sorry, on to
exactly.
the next one.
Yeah, no. So it's related. So it's, research and CDMO. So how do you do that? There's a number of ways to approach that. I mean, first you can ask industry colleagues like Gene and I ourselves and for recommendations. I get asked that question quite often. Uh, who can do gummies, who can do whatever. And actually you'll find that CDMOs will be segregated. Ones that do powders also do capsules probably because you're blending,
Right.
it's basically blending a powder. And then usually if it's a powder, then that means if it's going into a tub or a sports products, a lot of sports products are powders or stick packs or whatever, then flavor is going to factor into that. But they may also do tablets as well. So you'll see the dry forms will be kind of CDMO focused in that. And then you'll see separate manufacturing operations for gummies, which is, pretty specialized. And actually, a lot of people that do liquids, do topicals as well. And there are not that many
Yeah,
CDMOs that
that's right.
do liquids because it's the same sort of process in terms of the format, in terms of what you're dealing with there. But that's kind of the basics there. So the other thing is you can go to Supply Side West. That's the biggest trade show for manufacturers and suppliers.
Right.
You can walk the floor, and I don't know, a little trick, Gene. I don't know if people know this. You can actually go to the website and go to the exhibitor list and actually screen who all the CDMOs are and filter by what you're looking for. If you're new to
That's right.
this, you can go find the right guys to do that. And by the way, let's think about your product. We talk about defining requirements. If you're going to be working with probiotics, a lot of CDMOs can't handle those live
That's
organisms. So
right.
there's special, setups in terms of the manufacturing operation, in terms of handling live organisms, because you don't want cross contamination and all that kind of
You
stuff.
don't want
So
cross contamination. And also, if you don't handle them and store them correctly in the
yeah,
first
that too.
instance, then these live microorganisms may be dead by the time they even get into the product. So you really got to make sure that if you're doing probiotics, that whoever's doing them has experience doing them and is set up to do them and has the correct ways to store them in a temperature efficient way.
Exactly. And you want to choose somebody when you're kind of narrowing down the list. You want to choose somebody that's actually got a strong track record in the dietary supplement industry. So,
That's right.
so my kind of rule of thumb on that is, if you're not exhibiting at Supply Side West, I'm probably not interested in you as a manufacturer because you're not really serious about the business. So, in terms of quality or standards, I'm not saying that there aren't good quality manufacturers who don't exhibit. However, if you're really serious about building a business in this industry, then I'd say you got to have a presence. You got to be out there. You got to be in front of people to do that. Um,
You do.
yep.
Uh,
And
and
then
what
go ahead.
Go
Yeah.
ahead. Yeah, I was just going to say one of the things that you touched on briefly, but I think in researching it, you really want to look at is, and this kind of goes along with experience and having been around for a while as a CDMO in the business, is to find out about um, do they have any types of third party certifications? Now, the most common one that you really want to look at is your GMP certified. Organizations like NSF do
Yeah.
GMP certification, and that third party certification isn't just something that's nice to see. Sometimes there's international customers who want to see that, and that you may be doing business with other countries where they're like, no, we don't want it unless you got third party GMP certification, or even something like Amazon where they want to see that something is manufactured in a third party certified lab, or even places like CVS. They want to see that you have third-party certification and GMP. So you always want to see somebody could be following the correct GMPs, but unless you have third-party verification, you may have difficulty getting into the places that you want to get into to sell your product. And so those are things that's just very, very, I think, fundamental. I don't even consider doing business with anybody who doesn't have a third-party GMP certification these days.
Yeah.
I just don't.
Yeah, I agree. And I could speak a little bit more to that because I actually helped NSF years ago start their program. So, and a number of industry members. Yes. So I'm kind of biased a little bit on that because I remember the trade show. I think it was, I don't know, I think it was Expo. I don't know, it's a long time ago. And that could be 20 years ago or something now. But I remember going to the trade show and there was this one little row of little 10 by 10 little booths, like little side booths. Remember, supply side used to be part of Expo. You had the product, and then you had supply side contingent before supply side itself became big.
They were also calling, and then eventually they called it Ingredia, like they gave it its own little name.
Yeah, that came later.
Expo.
Yeah, that came later.
That came later.
Well, that was before that actually. And so then on this little row, I remember going checking it out because I'm all about the science. So I started talking to the people at all these booths, and I'll tell you who's there, and now you know who's not here today in the industry. So NSF was there. I talked to them. USP, okay, those guys got a program they do. And then you can research these programs, by the way, the ones that are active today, to see which one is most comprehensive that serves your needs. But then there was like Underwriters Laboratories, Better Homes and Gardens actually. I laughed when I saw that, but and I can look. There was like 10 of them, and to be honest with you, most of them are, well, they're not here today servicing the industry. So NSF would probably be number one on my list. But anyway, it's kind of funny to see how the industry has evolved over the years, and this is a good thing. I mean, it's moved in the right direction for that. But for sure, this important point about a third-party certification, whether it's NSF or UL or USP or whatever, that is, the manufacturer can be certified, but then there's another level of certification for your product. So let's say you go to an NSF CDMO, that's great, but that doesn't translate to your product. So you'd have to work with NSF directly to certify your product third party to make sure, and they do two things with that, to make sure that it's safe and it meets label claim. All right. And label claim, even today, we've seen it right in the news. There's still products. Now Foods is doing this. They're pulling products off the shelf. Consumer Labs is still doing that. And they're testing products on shelf and they don't meet label claim. So for me, that's just kind of a no-brainer. Guys, you got to do the stability studies. Make sure you have the appropriate overages, whatever it is. If it's a very sensitive ingredient, and you got to make sure you meet label claim. That's just pretty basic, So certification is real important. And then just to wrap up on this, when you start narrowing down the list, obviously, if you pick somebody that's got a strong track record in the industry, you get recommendations, whatever. Likelihood is they're probably financially stable as well. If you think about the operation of a CDMO, they have to maintain inventory of raw materials, the GMPs, quality systems, all this stuff, because they can be inspected by the FDA at any time. So this is takes a financial resource, capital to do that sort of thing. So really important to ask all these questions when you start interviewing these CDMOs at the beginning.
That's right.
Anything else you want to add on that? We'll go to the next one.
No, I think you've pretty much covered that. I would just add that one of the advantages to the GMP certification is that third party is looking to make sure that the facility is adhering to the different regulatory requirements. And so how do you, when you're investigating your own potential CDMO, how do you determine if they're compliant with the regulations? Well, unless you have a background in that and you understand what to ask, you may not know. But if you see that it's NSF GMP certified, then that's a pretty strong indication that they're adhering to regulations. That's all. Anyway, continue.
Exactly. All right, so let's go to number 3 on the list. And that is evaluate the capabilities and services of the CDMO. So let's say you have your short list here. You pick five, three or five, and you want to start assessing that. So what's the first thing we're going to do, Gene, when we get to that step?
We're going to see what level of services they offer. Is it comprehensive, or is it only certain services that they're offering? For example, there are some CDMOs who will offer something as simple as, oh, we have in-house graphic arts, so we can help you develop your label art. And there's
Yeah,
others who
that's a good
don't.
one.
They don't
Yeah.
have that. There's ones that have in-house um, laboratory services where they can do assays and they can do testing. And there's others that don't, that has to be sent out to third-party labs. So you want to understand what full and comprehensive list of services are that they have to offer, and that even includes manufacturing. For example, you may say, "Oh yeah, we do packaging. Oh great, you can put it in a bottle. Yeah. Oh, can you put the bottle in a carton in a box? Oh well, we don't really do that. We have to send that out to somebody else. Or we can make your powders, but we don't do stick packs. We have to send that out to somebody else. So you have
Right.
to take a look and make sure. And if it is sent out to somebody else, that is not necessarily a bad thing. It just means that you have to know that that's part of what you're looking at, and that means that it might take a little longer because it has to be sent out somewhere and come back. But you need to know that up front and not have any surprises.
Exactly. And I think, I've dealt with this many times, depending on different CDMOs I've worked with. Um, you if you can get a CDMO that's strategically, it's more strategic for you, saves on time and logistics if they're not shipping out the co-packet somewhere else, or they're sending the labels out, sending the lab out. You better factor that into your timeline if that's somebody you want to work with, and also the additional costs, for that. And I think from my experience, because I'm a formulator, maybe I'm in a different situation. I would come with a formula already to a CDMO, but I would look for their assistance on the supply chain, sourcing that. I would already have the source, maybe even pricing for that
Exactly.
ingredient. So then you want to look at their ability to manage that, because supply chain has been a big issue, especially COVID. It still is actually in terms of supply of certain ingredients. I don't think a lot of people realize that some things are challenged in terms of supply. Um, if I just use an
Some things
example,
still are. It's true.
exactly. So to use an example of that, during COVID, if you remember, immune support, in the industry all kind of took off, but immune support category itself took off in terms of products developed there. And you know what the leading ingredient was at that time? Elderberry. I mean, I remember walking into vitamin shop and there was a whole shelf dedicated to elderberry supplements, okay, for immune support.
Right. Right.
And what happened because of that, it all has to do with supply and demand. Because there was such a high demand for that ingredient, that's when the bad actors started showing up for supply, saying, claim they had it, taking advantage of that when they had adulterated ingredients or whatever. So again, really important that the CDMO is aware of that. I remember at the time, one of the CDMOs that I was working with was not aware of that. And, I asked the question, hey, are you guys testing your elderberry supply? Are you confident that this is truly elderberry? That sort of thing. So, these are kind of one-off things that can happen in the industry because of a supply and demand issue. So it's important to,
That's an excellent point, Bill, because
yeah,
one of the things, if you, let's say you don't have in-house testing capabilities, okay, which is okay, but if you get a raw material that comes in, you
yeah,
can't just say, oh, well, the raw material supplier sent me a certificate of analysis, so I'm good.
yeah, yeah,
You have to send it out. You have to test it and verify. I can't
hmm
tell you how many times I've had situations where I once worked as the VP of technical services for a contract manufacturer, and I remember we had an in-house lab and we tested an ingredient and found that it wasn't that ingredient. And so that raw material supplier came to pick it up because they were a local supplier.
yeah,
And we saw on the clipboard of the guy that says pick up and deliver to, and they were actually delivering it to a different CDMO. Um, you know, and it was like,
yeah,
I mean, it's just so if you can't test it yourself, make sure to send it out and don't take the raw material supplier's word for it. Even if they seem to be a reputable supplier, trust but verify.
Right. So it's you've got to do your due diligence, which leads us into our next step, okay, which is there we go, boom. I love that. Um, you want to conduct due diligence, okay? Don't ever take anything at face value. Too many times, I never did that because you got to be proactive, okay? And a lot of people are reactive and react after the fact, and you're putting out fires. Well, don't do that. Be proactive. Do your own due diligence. Get consultants, maybe guys like us to help you, or somebody that can actually help you evaluate a CDMO and that sort of thing, because we've been there. But conduct your due diligence, right? So you're going to look at, a lot of times, CDMOs won't share with you who their customer base is, right? Because it's highly competitive or whatever. But sometimes you can find out who manufactures whose product or whatever, usually from referrals, when you're asking for recommendations. Say, hey, these manufacture our gummies for us. They did a great job, and okay, then you know that. But you want to check your references and referrals and all that kind of stuff. So let's say you're down to your short list of 3 top CDMOs for a gummy. Okay. No, let's make it a powder. I want to make it a powder. What would be the next step, Gene, for you?
For me, if I had already checked references, talked to people, and whatever, then my next step would be to conduct a GMP audit, a site visit.
Exactly.
I'd go out there. I would have my checklist. I would send them paperwork in advance to fill out that then I could review before I ever got there. And I would plan on spending anywhere between 1 to 2 days there doing a
Right.
comprehensive GMP audit of their facility. Now,
Right.
if you don't have the experience in how to do that, all right,
Yeah.
I'm going to tell you, you need to gain the experience. Because guess what? You're required as a brand owner to
Right.
do the due diligence
From a
and to
regulatory standpoint. Yeah.
you're supposed to do a GMP audit. But if you've got nobody on your staff that does it, then hire a consultant who has an expertise in that and
Mhm.
accompany them. All right. Go with them so that you can see how it's done and gain knowledge and experience.
Yeah.
You do a few of those and you're going to be like, oh, I got a better handle on how this is done. Doesn't make you an expert in it, but it makes you maybe better able to do that. Because look, both Bill and I had to start somewhere. We saw people who knew how to do it, and we learned how to do it.
Right.
And you can too. But you need to conduct that GMP audit. If you don't know if they're doing stuff
Yeah.
correctly. I have done GMP audits where I went, wow, they looked great on paper. They look great from a distance. And I went in there and I was like, I would never do business with this place. They are just an accident waiting to happen. There's probably a had accident. It's just not good. And then I've done others where in the first 10 minutes I'm like, oh my God, they're buttoned up. They know what they're doing. But I
Yeah.
complete the audit. So
Sure.
it's vitally important that you do that.
And another piece to that audit or due diligence is it's not the site visit. You got to do that, and but you can check. You can go to the FDA's website. You can go check to see that they were inspected by the FDA. Were they issued any 483s? Were they
That's right.
resolved? This public information. So the manufacturer may not tell you that, but you're going to need to do your own due diligence to that. So again, don't take anything at face value. Be proactive. Really go through that in terms of the site visit and meet the team with people, whether it's the science team or the manufacturing team or whatever. You want to take the time to spend time with that. That says you're serious about that. And then check the audit reports and even ask them, have they been inspected by the FDA, and ask them to show you their documentation on that sort of thing.
That's right.
Okay. All
Yeah,
right.
don't be overly concerned if they haven't been lately. Chances are, if they've been around for many years, they have been audited. But if they're
Sure.
relatively new and everything else is good, they just may not have been audited yet by
Yeah.
FDA.
And actually, there's literally, I don't know, 1,000 or so. I don't know CDO. I don't know what the number is, but Pre-COVID, the FDA was only and I saw the statistics on this from them. They were only inspecting, able to get to like 500 manufacturers a year or something like that. It was a very low number
Oh yeah,
compared to the number out
low
there
number.
manufacturing. And it actually, in some cases, if obviously if a manufacturer was an issue, they're gonna revisit, right? So again, this goes back to our earlier point. Make sure choose the guys that are right for you. Okay. All right. This leads us into what is it? Step 5, 6, 7, 5. Okay, here we go. All right. Now you've narrowed it down to 3 CDMOs for your powder. Okay. You're comfortable with it. Apples to apples comparison. They probably, you look at all their turnkey services. You have your spreadsheet with your checklists in terms of their capabilities, turnaround times, all this kind of stuff. Now it comes down to comparing proposals and negotiating on pricing. Okay, big deal. And remember, you mentioned this earlier, Gene, about quantities, right? They may not have the capacity to do small batches, especially if you're a new brand owner and you just want to test market. Actually, the companies are doing this now in a D2C, direct to consumer fashion online, where they want to test the waters on a product formulation first before they scale up. Okay,
Right.
so there are some manufacturers that their minimums don't allow you to do that. So you got to
That's right.
factor that in. Again, back to your earlier point, what is defining your requirements? You want to make sure you want to do that. So now you're down to proposals and negotiate. And so, Gene, what's the first thing for you, man, when you start doing that?
Well, once I've gotten down to that point, then I want to look at, obviously what the costs are. And for me, that just doesn't mean I'm just saying how much do they charge versus how much they charge. It's how much does each one charge and what does that include? Is it
Yeah,
including is it including testing? Or is it not? Is it including any other hidden costs that you need to know about? Uh, because what you don't want, it's kind of like when you go on an airline, like say American or Delta or some big airline. It for the most part it includes most things. Then you go on an airline like Spirit or Allegiant or Frontier, and to get up and go to the bathroom seems to be a charge for. I'm being facetious, of course, but you
yeah,
want to drink a soda, okay, that's a charge. You want this, that's a charge.
yeah.
And anything is a charge, and so you want to make sure that this really good pricing isn't really good because they're not including all the components. So check out thoroughly, make it a real apples to apples comparison, understand what's involved in that, so that you get a true idea of what the costing structure is for you.
And make sure there's no hidden costs in that, right? Okay, something they
Yes.
didn't tell you about. You don't want to be coming back later. You committed to something and find out, oh no, there's an additional cost for us to go do the labels there. What? No. And actually, some brand owners they like to do their own labels.
And
Okay,
that's fine.
and that's
Well,
fine,
actually,
except you better have that piece of the puzzle done down very good on your side because you have no idea the complications that could create for the CDMO. So, um,
oh
uh,
yeah. I
yeah,
don't know about you, but whenever I
yeah,
dealt with a product, even though I have background in regulatory and I made sure my label was as squeaky clean as it could be, I
yeah,
would always send it to the QA department, or the regulatory department, whatever they had at the CDMO, and say, "Can you please
yeah,
review it and let me know if it's consistent with your paperwork?" Just to make sure that nothing is out of whack. And once in a while, you'd find, "Oh yeah, this is different. Oh no, that's not the right excipient, or that's not the right whatever." You want to make sure it is correct because there's nothing as frustrating as having them at the 11th hour come back and go, "Oh, your label's wrong," and now you got to reprint the label.
yeah.
Uh, you know,
It's going to affect your lead times and getting in the queue for production and delay your product launch and all that kind of thing. So you really have to think about all these moving parts. There's another key one here on this contract negotiation, and that is IP, intellectual property.
oh my goodness, yes. You
So
want to, yes.
I mean, so if you're bringing, if I mean, there's a lot of scenarios for this. If the manufacturer is bringing to you a formula, well, then if you don't have any ownership in terms of that formulation, and then it's just then the IP is going to belong to either an ingredient supplier or the CDMO if they develop that or something. But Or if you're putting something together that's your own proprietary formulation, maybe you have some clinical research on that, some a pilot study, that sort of thing. Um, actually, we didn't mention this before. That's a good point. Let's say you want to do a little pilot batch that's not scaled up commercially so that you can do some maybe taste testing, or you want to do a small clinical study and that sort of thing. You got to make sure in terms of those capabilities, the manufacturer can do that for you as well. But back to intellectual property. So this is a biggie here because you don't want to get into a big fight later over who owns the IP on something. So this is kind of a one-off scenario, right, Gene? It depends on the situation and what your requirements are, what you're trying to produce, and that sort of thing.
But that's vitally important because I've had situations occur before, not often, but where you have an agreement and you look through it and it actually says that they own the intellectual property. That happened once, and I was like, no, you don't. This is our formula. You don't own it at all. Take that out. And they took it out. But if you just kind of
Yeah.
sign an agreement and you don't look carefully at it, that
Hmm.
you may discover something in there that you don't want at the 11th hour. And intellectual property is vital because look, you want to own your formulation. That's what you want to own. You want to own it. Now, let me be clear on what that means.
Yeah.
If you're doing a powder and the CDMO is doing all the flavoring and stuff for you, it's hard to say then that you own all the excipient information, the flavoring information. You may own the active ingredient information, but
Hmm.
you can't then decide, oh, I'm going to leave this CDMO and go somewhere else and ask for the full batch records that has everything in there, like the full recipe that you can then take and hand to somebody else, because
Right.
that contract manufacturer is not likely going to give that to you unless you did all the work up front and you worked with an external flavor house or something like that, where then
Exactly.
your final formula you did own and now you're sending that out to several
Yeah.
places to give you costing on. But
Exactly.
whatever it is, make sure you know what you own. You own your own formulation, your own active ingredient formulation. They don't,
Right.
and you want to make sure of that up front.
Exactly. And in that contract, you want to cover confidentiality, production timelines, quality assurance clauses, for quality issues that might come up. So there's a stepwise procedure. First, it's usually confidentiality agreement. Okay, you've agreed to go with a certain CDMO. You sign a confidentiality agreement, and then what you're dealing with them is then they're going to keep that confidential between you and the CDMO. They're not going to discuss that with other people that they're making products for. There's a wall there, which is great. Okay, so that kind of covers proposals, negotiation, contracts, IP, that sort of thing. And let's go into our step 6, and that is boom. All right, now you got to make a decision.
Oh
Okay.
no, decision
so
time.
okay, this is, I mean, look, I'm very kind of organized about that. So, I take a spreadsheet and I put together a matrix, decision matrix, and rank the CDMOs based on their capabilities, their costs, whether they're compliant, and do they meet all the requirements. More turnkey for me is kind of cool. Although there's another layer for this, I'm usually very actively involved with sourcing premium ingredients. I don't rely on the CDMO
Well,
to do that because I have an idea of what I want to formulate. But let's say you
of
don't.
course.
Yeah, so it's different, but depends on the scenario. But that's kind of the first part. You have a decision matrix that now you've got all this costing, you've got everything laid out, and then you have to decide who to go with on that point. And then after that, Gene, what do we want to do? We want to do a risk assessment, right?
Yeah, that's what you want to do. You have to consider all those potential risks and any strategies you might need to address or mitigate that. So that is vital. I just want to go back for a second. Something you just said that resonated with me,
Yeah,
and
yeah,
I think it might be worth mentioning to our listeners. You said that when you formulate a product, like me, we look at quality ingredients from quality suppliers, particularly ingredients that may have already had some good human clinical studies on it that can serve as a point of making claims because there's research to support them and that you're using the right stuff from the right studies. Now, not every ingredient has to be that. You may have certain herbal ingredients or certain other kinds of specialty ingredients with that kind of research on them. On the other hand, you may say, well, you know what? I need to put some vitamin C, some ascorbic acid in this product. And in that case, you may not care as much as long as it's a quality raw material supplier that meets the specification on the vitamin C, you may not care whether it's from supplier A, B, or C. Whereas if you're getting a certain strain of a probiotic, it's got to come from that one. But that's again where you give maybe a little bit of leeway then to your CDMO to say, okay, if you've got a supplier of ascorbic acid, in this example, that you're comfortable with and that you've worked with and that meets the specifications, that's fine. You don't necessarily have to. But you definitely want to specify if you're using a certain, if you have a very specific claim that's associated with a very specific raw material, that you use that branded material. I just wanted to mention
Yeah,
that.
that's a good point. And um, again, it starts at the beginning of really defining your requirements of what you're trying to accomplish here. The last thing I want to speak to on this point or this step is the risk mitigation. Okay, so
Yeah.
I don't care how good you are and all the steps we just talked about, stuff happens. Okay, so
Yep.
COVID happens. Okay, that's a big one. But no, it could be, the equipment breaks down or whatever. So you need to understand from the CDMO what are their risk mitigation strategies, and you need to map that out. Here's another scenario. Let's say you're working with a smaller manufacturer. I've been in this scenario. They have a specialized dosage format. There's not many guys to go to. So let's say you've already qualified them. They're certified and all that. How do you manage if you have to go, if something happens to them and you have to go somewhere else to do a format? Okay. And I'll use the example of the oral dispersible film. Okay. Because it's
Yep.
the
It's a good
strips.
example.
And something that I've already dealt with where we worked with a small manufacturer and they had a certain capacity. Yeah, they had a max they could do. But let's say your product's hugely successful and blows up. That's a good thing, right? But it can also be bad if you don't have a risk mitigation strategy to handle that. Manufacturer may not have the personnel or the manufacturing equipment to handle the capacity, even if they run 2 shifts or something. These are all part of the things you need to consider as part of risk mitigation. Really, really important.
That's right. So even if you decide on manufacturer A instead of manufacturer B, you want to keep manufacturer B in mind because you may
Well,
need them as a backup too.
Well, and this is a good point because it's a balancing act. It's like, okay, you want to rely that I think this scenario only happens when you're dealing with a kind of medium to smaller size manufacturer, maybe in a specialized format or something. But you know, uh, it takes time to get Plan B up and running. Okay, to get another CDMO up and running. And if you think about it, they're going to have to validate on their equipment. There's we didn't talk about this, but they're going to have to, when they scale up commercially here from pilot scale, they're going to have to do a validation batch, and so these things that take time. So this is going to affect your lead time. So be very very clear on your risk mitigation strategies for all possible scenarios that you can think of. And I think you and I, Gene, have probably experienced all of those at one time or another.
Yeah.
Okay, we got a couple more steps here, so let's go to the next one. And that is initiate collaboration. All right, you've settled on somebody to do this. You're committed. You've got all the pieces in place. Now you need to onboard them. And Gene, the biggest thing is, and it doesn't matter any business negotiation, is communication, communication, communication.
Communication. Yeah.
Got to be
And that has
proactive.
to be so clear on what that path is. How often are you meeting with them? How often are you having communications? What is the expectation? Do they agree to it?
Exactly.
Do you agree to it? Schedules, updates, you've got to have that. If you don't have that, you don't want to get surprised. You don't want to be like, oh, it's going to take you 8 weeks. Okay, I'll call you in 8 weeks and see if it's all right. You got to keep,
No,
you have to
no,
keep,
no, no.
yeah,
No, you
you got to
need.
keep
Yeah,
some regular communication going.
exactly.
Understand, okay, what is the starting point? The starting point for them is typically the day you hand them a PO. Once they've got a PO,
Exactly.
then,
Yeah.
all right, how long does it take you to get your raw materials? Okay, what's the status of those? Okay, what's the problem raw materials? Oh, and that was going to take you 6 weeks? Okay, all right. And you go through this. You want to understand where they're coming from, because you just don't want to get surprised and have them come back and go, oh, it's going to take 4 more weeks for whatever. You need to know on an
Yeah,
ongoing basis what's happening.
yeah. And that's part of it goes back to the mitigation strategy. Let's say you have an ingredient in your product that they find out that suddenly there's a shortage, and that happens. Okay, and then it's going
It
to be
does. It does.
it's going to be an
And you
additional
have to
lead
be
time.
prepared.
Yeah, you got to be prepared for that. So uh, it's always good to have a good Gantt chart, in terms of the project and how you're managing that from soup to nuts, from beginning to end, and that sort of thing. So, but have a good communication plan in place, regular communication. Again, you're not just handing it off. Typically, once you've got down to the point where you've decided on somebody, then it's probably with 30 days or less to get your pilot samples, especially if you got samples like a powder or a gummy or whatever where you need taste testing or whatever, because you could have another round of going back to the bench and trying to tweak it a little bit, that sort of thing. But again, you need to define your requirements. The bane of any manufacturer's existence is a customer that doesn't know what they want and they change what they want.
So much that happens all the time. And one of the things I used to do when I worked for a finished goods company,
Yeah.
and we used contract manufacturer, we had different people in different departments responsible for different aspects of the product development. And what we had a long list that we put in an Excel spreadsheet where we said, it's going to take this much time for this thing to be done. And we would put in dates, and it would auto-populate. And if something got delayed, boom, put in a new date, boom, 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 all the way down the line, auto-populated to be all of the final day that when that thing's going to launch is delayed. So understanding the role that each step and each person plays in that is a good thing to do. So that and that's just a good internal practice, but it's also good external practice with your CDMO to make sure that any delays on that part figures into your process. Because if you do have an unforeseeable delay, you need to know, well, does that affect my launch date? Does that affect all these other things that are part of this? So that communication is just vital.
Yeah, and no offense to the marketing people out there, but you guys need to have your act together in terms of who your consumer is and what you want to do in the beginning. If you don't, and then change, oh no, we want to change and do this now. We want to change and do this now. You just added time. So, of course, that never happens, right, Gene? I mean, everybody knows exactly what they want to do right from the beginning, right?
Now, listen, especially when you're talking about new people to the industry who are going to start a new brand, their new line. They're very excited. Some of them, very, very rarely, come with a very set idea. They pretty much know what they want to do and move forward. Most of them have somewhat of an idea, but as they go along, they're learning new things, and they go, oh, I need to switch and do this. Oh, now I need to switch and do that. I used to do I changed my consulting rules when I would work with somebody on a new product. When I had somebody who had 10 different iterations of the same formula, and every time I had to redo my white paper and redo it. Now my new thing is this. I will work with you when I write the white paper and we have the formula. I will allow a total of 2 changes. Anything beyond that is not included in the cost.
Well, you just called something out in terms of GMPs, quality, change control. Every time you make a change, it's got to go through approval process to get done right. Okay, so
That's right.
You can't just do it on a whim, whatever. It's not like we're making this stuff in a garage here, guys. Come on. Anyway,
Right.
let's go to our final step here, and that is monitor and evaluate. Okay, so set up some performance metrics. Okay, for sure, everything's going. You've dealt with some challenges along the way, and boom, your product launches. It's in the market. It's on shelf, whatever, online. You want to do it really important. You want to regroup with the CDMO. You want to do a postmortem on the project with all functions involved to get everybody's input of what went right, what went wrong, and how we could do it better next time. Because you're not going to do it one-off. hopefully, where you're going to produce a lot and then that's it. No, you're going to produce additional lots and hopefully you're building the sales of your product. So you definitely want to conduct that postmortem after that first launch and look at the product quality, were there any compliance issues, that kind of stuff, and really detail that out so that you can make improvements and streamline the process. Gene,
That's right.
anything you want to add to that?
Just this. One of the things that can help with that, guys, is internally, your own brand might provide a product specification to your CDMO, where you're saying, these are the things I want in it, here's the kind of bottle, here's the kind of testing and all of that. And that's great on your end. But you provide that to the CDMO, and they got to come back to you with their version of that specification. They're not working off of your specification. They're taking your specification and making their own specification. Then you want to see that, and you want to review that, and you want to make sure it's consistent with your specifications. You want to make sure they match, because I've had that change too. So this final step is vitally important to do. Make sure that the specification at the end, that if you guys agreed on some changes, that you then as a brand change your specification to match that, so that next time it's going to be made, you're turning in your specification. It's consistent with the specification you guys finally agreed upon, and it is going to help streamline the process. Not only has it been done before, but it's a reminder. Don't send them your original specification from last time if it's changed. Make sure you've updated it, sent them the correct specification, and it'll streamline the process. Like Bill says, you got to do that postmortem and make sure everything is consistent, and then it'll be much better.
Yeah, and especially, and this has been in my experience as well, especially if you're working on a global project where it's launching in more than one country. Okay, there's several other layers to that as well in terms of not only regulatory compliance, claims, labels are different, for example, or they have a different language, that sort of thing. So of course the complexity of something like that goes up quite a bit. So even more reason to do that postmortem and really evaluate what went wrong, what went right, and how you can do it better. Okay. All right, Gene, I don't know about you folks, that's the 8 steps. You can replay this back and capture those. We're going to wrap it up here. Glad we got our technical sound difficulties figured out. That was cool. Because I'm traveling next week, and then the week after, we do this every 2 weeks, first and third Fridays of the month. And I think, Gene, you're going to be at Vita Foods in Geneva, correct?
I'm going to be at Vita Foods in Geneva, the week after next.
Okay. So I wish I was going. I am not.
I wish you were too.
But yeah, no. But maybe next time. And just thinking ahead,
maybe I'll have a couple of interviews. Maybe I'll be able to interview some people there and bring that back to our show. We'll see.
So stay on the lookout for that. I don't think we can do it on that Friday because I think you're traveling actually. So we may have to do it after on that one, shift the date a little bit. But that's okay. Well, you'll see the announcement for the next. I don't know what the topic's going to be, honestly. So we'll figure that out within the next couple of weeks as we go forward. So without further ado, I'll take us out and thank you all for joining today. I hope this was useful.
Thanks.
I hope you got some great tips from what Gene and I talked about. And we'll see you on the next one. Okay? See you when I see you.